Assalamu alaikum. The article of this week is titled Laboratory Investigation of the Effectiveness of Different Acids in Removing Mineral Trioxide Aggregate from Simulated Root Canals. It's an in vitro study done by Abbott and recently published in Australian Endodontic Journal. So far, no method has been reported for the removal of hydraulic calcium silicate cement from the root canal once it has set. This is likely to be the biggest problem associated with this cement, as it may deem the tooth unsalvageable if reinfection were to occur, or endodontic surgery may be required. Therefore, the aim of this study was to evaluate the use of different acids concurrently with ultrasonic tips and rotary retreatment files to establish effective protocols for the removal of set hydraulic calcium silicate cement from root canals. With a dichotomous endpoint, the sample size calculated to be 50 acrylic blocks with 10 degrees curvature. The blocks were instrumented and then weighed using a digital electronic balance. Then the root canals were filled with the ProRoot MTA white, and the coronal 3 mm of each canal was left unfilled to provide a reservoir for the later insertion of the acids during the retreatment procedure. After 10 days, to allow a setting for MTA, weighing of the samples was done again and radiographs were taken. Samples were then randomly allocated to 5 experimental groups: 10% hydrochloric acid, 10% citric acid, 2% acetic acid, and 2% carbonic acid, 20% tartaric acid. For each group, 2 drops of the corresponding acid were placed in the unfilled canal reservoir of each sample for 3 minutes. Ultrasonic tips and ProTable retreatment files were used to remove MTA with a continuous replenishment of the acid, which was delivered using a syringe. The retreatment process was deemed complete when the file reached the full working length. An iatrogenic error such as ledge or file fracture occurred, or when the working length could not be achieved after a period of 30 minutes. The removal of MTA was evaluated with 3 methods: the MTA mass difference, radiographs by using luminance or radio opacity at different levels from the working length, and the ability to reach the working length and the time taken. The full working length was reached in 9 of the 50 canals. This table 1 shows the weight difference, and the pairwise comparison showed that 10% citric acid group had a significantly higher value than the 10% hydrochloric acid group, but no significant differences were found among the remaining groups. As for luminance, regardless of the distance from the apical end of the canal, there was no significant difference between tested groups. Lastly, for the time taken to retreat, the pairwise comparisons showed the time measured for 10% hydrochloric acid was significantly longer than all other groups except for 10% citric acid. In conclusion, although none of the acids tested were able to completely remove the MTA root canal fillings, 10% citric acid was generally more effective, and 10% hydrochloric acid was the least effective. Challenges in removing MTA beyond root canal curvature persist, suggesting a need for improved techniques and tailored acid to enhance MTA dissolution.